Hey everyone, this is Bill Neidhart. I'm here with Belen Sisa and Josh Miller-Lewis.
Good to be here. Good to be back.
We have a fun episode planned, a live stream that we're doing here. Actually, the one and only Levy Sanders is watching us live right now, according to my comments. So hello, how you doing? Basically, we're getting into three things today that we're kind of going to focus on. Medicare for all, of course. Bernie had a big speech yesterday. We're going to talk about how the media has been covering Medicare for all, how they've been covering Joe Biden lying about Medicare for all, whether or not they've been efficient enough in checking the lies that Republicans and now Democrats have spread about Medicare for all. And we're also going to talk about an historic day in the U.S. House of Representatives.
Indeed. For working people, right?
For working people, for everybody.
Victory.
It's rare in the United States Congress.
Yeah, we are talking about, for the first time in decades upon decades, the U.S. House of Representatives voted to increase
12 years or so.
12 years. Oh, okay. Only 12 years.
But I just want to be get our facts straight on this show.
Yeah, that's fine, because we're going to complain about facts later in the segment. The U.S. House of Representatives passed a bill, the Raise the Wage Act, for a $15 an hour minimum wage. It's something that Bernie has been fighting on for years upon years. And,
it's a big moment.
Yeah,
so
let's give Bernie, yeah.
All right, here we go.
Let's let Bernie tell it too.
I want to applaud the thousands and thousands of workers from coast to coast, people who work at McDonald's, people who work at Burger King, people who work all over this country, who have stood up over the years and demanded that the federal minimum wage be raised to a living wage, $15 an hour. And because of what they have done, 7 states have now raised that minimum wage to $15 an hour, and the U.S. House of Representatives has done the same. So we have made real progress in that direction. But now we have a situation in the Senate where the Republican leader in the Senate, Mitch McConnell, is refusing to bring that legislation passed in the House to the floor of the Senate. He doesn't want to have his members have to vote against raising the minimum wage to a living wage. And the way we defeat Mitch McConnell and the way we raise the minimum wage in this country to $15 an hour is when millions of people say to Mitch McConnell, hey Mitch, have the guts to bring that bill to the floor of the Senate. If you want to vote against it, you go back to Kentucky and tell the people there, we're trying to make it on $8 or $9 an hour while you did. But at least have the guts to vote that bill up or down. And if you bring it to the floor, I kind of think we're going to be voting it up. So what I need right now is I need your help to add your name to our petition to demand that Mitch McConnell bring a $15 an hour minimum wage bill to the floor of the United States Senate. Thank you very much.
So, if you want to fill out that petition that Bernie was talking about, sitting actually right here, I think, go to live.berniesanders.com. You can sign the petition there. You can watch us live right now, actually. You can get into the comment section as well. And, of course, you can donate while you're watching, which really helps fuel our movement and everything like that. And one of the reasons we're talking about this is because it's something that can get done and help out working people.
Yeah.
You're from Arizona.
Yes.
Do you want to talk about Arizona for a little bit?
Yeah. And I mean, this is why it's such a historic moment, right? It's because working people fought tooth and nail to make this happen. People didn't just decide all of a sudden, especially in Congress, to just do something for working people. We forced them to do that, right? And I think that that's what this campaign is all about, and that's how we're going to win and how we're going to get things done. But like Bill said, I'm from Arizona, and Arizona would be the last place you would think that a local fight like this would, get to where it's gotten. In 2017, or 2016 actually, we passed Proposition 206, which was a voter ballot initiative that helped raise the minimum wage. Right now, it's $11 in Arizona, and it actually even included paid sick leave. Which is something that workers in America are still fighting for. And the biggest myth that we've seen is that if you pass a higher minimum wage, you will lose jobs. Well, Arizona is proving that wrong. The Arizona Republic just recently reported on this today, that a study came out by the Grand Canyon Institute, which they call themselves a nonpartisan organization.
Yeah. They're not looking for good news when it comes to this. I think it's fair to say.
Yes. And they said that they found no clear evidence that there were job losses, even though they would be expected to give higher wages to their workers. So we're talking restaurants, bars, food services, basically any place that you could think of that their workers are being paid minimum wage. There is no evidence to show that because people are being paid a living wage, businesses can't make money.
Yeah. That's a good. Don P has a good comment here. He says the $15 minimum wage is to be implemented over 6 years, so it's only about $1.25 increase per year. Businesses can handle that. It will be good for the economy.
Don P is correct.
And even AOC said, like the fight isn't over, right? Like with inflation, we're going to have to continue to keep fighting for a living wage, right?
Right.
So this is a huge milestone in that journey of trying to fight for the working people of this country.
Unity Love is shouting out Arizona right there.
Yeah.
Recently came back from AZ, got a little bit of a tan.
So, one of the things that we want to continue to hear, if you have made less than $15 an hour in a job before, I have, it's not easy. Share your story with us. Of course, go to live.berniesanders.com to join the petition that Bernie was talking about, but also tell us what your experience was like. I think elevating the people, the voices of working people really changes the frame of this debate. That's what I think Bernie was able to do from 2015 to now, where we really have a greater sense of solidarity with working people. And I kind of want to show that video that we went to Cedar Rapids last month. Some of you might have seen this already. And Bernie joined a picket line of McDonald's workers walking out of a local McDonald's in Iowa. And he joined them on a strike there, and then later a march where they demanded not only a $15 minimum wage, but the right to form a union. And we went to the home of one of the workers who was standing with Bernie. And we asked her what it was like to not only be in the fight for a $15 minimum wage, but why this is so important to her and her grandson. It's really moving, and I think it kind of tells a good story.
Let's watch it.
My name is Kelly Osborne. I'm a 44-year-old single mother. I also raise a grandson that's 5 years old all by myself. If I didn't have him, I probably wouldn't be here. I would have nothing to survive for. Nothing. He's my special angel. I work for McDonald's for $8.25 an hour, and it's just not a living wage. I'm not making it. I'm a stage 4 cancer survivor. The last 12 to 15 years of my life, I've been fighting cancer. If I miss a paycheck, I'm screwed. I would literally become homeless. Iowa is a lot of working people, hard-working people. Farmers can't make it, regular workers can't make it. We're just struggling, the whole state is. After paying rent, I barely have enough money to put food on the table and do the other things I need, like put shoes on my grandchild's feet. I live in such a small apartment, I have to go outside to change my mind. Well, my grandson has to sleep in the living room. His name is Ryden, and he is 5 years old, and he's partially autistic. What I would like to see for him when he gets older and gets a job is union rights, is $15 an hour, so he can survive. I work 30 to 40 hours a week, and I still can't make ends meet. And we need to stop it now. We need to make things better for everybody now, not in the future, now.
The fight at McDonald's is a fight for millions of working class people who are sick and tired of working longer hours for lower wages. They are sick and tired of not being able to afford rent or health care or child care for their children. Today we say as loudly and clearly as we can to McDonald's, pay your workers a living wage and negotiate with a union.
So I tear up a little bit every time I see that. But we've got a few comments that I just wanted to share with you, because this is real for a lot of people, and what we're fighting for will directly impact people's lives. We've already, had success with Amazon. We've had success with Disney. We've raised wages for 400,000 people as a result of working people standing up and making their voices heard. So we can change things. But more people have to stand up. More people have to call Mitch McConnell, call your Republican senator if you live in Arizona or in Iowa, and demand that they bring this to the floor of the Senate and pass the minimum wage. But, that Kelly's just one story. And Julia Angelina says, nothing horrifies me more than to see cancer patients working low-wage jobs. How do we allow this to happen? Heather says, I was also a barista for years and was paid between $7.25 to $8.50. Late Night says, highest I've ever made is $9.71. I'm an ex-felon. I don't have family. I had nothing, and I got in a car with a key and I slept in it. I mean, this shouldn't happen in the United States of America. People shouldn't have to sleep in their car because they can't make enough money to afford a home. And when we talk about Bernie Sanders and what this campaign is about and what this movement is about, the reason we make videos like this, it's to change that, because it's just not acceptable. And that takes us to the next part of the show, which is Medicare for All. And in addition to the battle that we're fighting over raising wages in this country, there are tens of thousands of people dying every single year in the richest country in the history of the world because they can't afford health care. And there's millions more who are going bankrupt or in financial distress because they have insurance and it's still unaffordable. And so yesterday, Bernie gave a major speech on Medicare for All. And we've talked a lot about Medicare for All, and we're happy to go into it more if people still have questions about what that means. But
a lot of reporters seem to.
Yeah, right, and we'll get into that later as well.
Yeah.
But one of the interesting things that Bernie called for yesterday was he put forward this pledge. And what he said was that you can't change our dysfunctional healthcare system if you continue to take money from the executives, the lobbyists, and the PACs that represent the pharmaceutical industry and the health insurance industry. These are the most powerful corporations in America. For years, they have blocked universal health care since the 40s to protect their own profits at the expense of people's lives. And yesterday, Bernie said, I will never take their money, and I challenge every single Democrat in this race to not take it. We saw Elizabeth Warren today.
She signed it.
She signed the pledge. But the question still remains, is Joe Biden going to sign that pledge? Or some of the other candidates in this race who have been critical of Medicare for All, but have taken significant sums of money from the health insurance industry, from pharmaceutical executives, will they sign that pledge as well and commit to guaranteeing health care for everyone in this country?
They should.
And I think it's not like, I think that's a bipartisan thing, right? Like I think everyone, whether you're Democrat, Republican, Independent, can agree that we've got to get corporate money out of our politics. We cannot continue to have large corporations representing and blocking progress in this country.
I think it says a lot about our priorities too, right? Like the priorities of the executives of this country, of the lawmakers, because if your priorities are lives, you wouldn't be trying to profit from them, right? Yes. So you wouldn't be trying to stop something that could help people. Because at the end of the day, what's money good for, right? If the people in this country are suffering, unless you're greedy. Unless you're greedy, right?
It is all intertwined. Kelly, who was the worker in that video that we just showed, minimum wage is what she's known for, being an activist around in Iowa, but she also is a cancer survivor, and she's still paying off her medical debt. Medical bankruptcy is one of the leading causes of bankruptcy in America. And, when we talk about a minimum wage, we also need to make sure that people actually have the health care so that if they do have the wages they need to make ends meet, they can also, get sick, go to the hospital.
And it's a good point, too, because we talk about, I think Biden actually made this point, maybe it was somebody else, that, workers have bargained so hard for these health care benefits, and why are you taking that away from them? Well, we want unions to be able to bargain for higher wages. We don't want them to have to worry about getting decent health care. Everyone should be guaranteed decent health care in this country.
Yeah.
Unions should be free to be able to bargain for higher wages. Not have to worry about that. And so it's actually, Medicare for All really is about freedom. It's about freedom, it's about security at the end of the day.
Yeah, a lot of this is about freedom. Minimum wage, again, is going back to freedom. The freedom to actually have a job that pays you a living wage so you can lead the life that you want to, so you can support your grandson and everything like that. It is all very interconnected. In terms of, the pledge and who hasn't taken it, I think there are some campaigns that, one, have fundraisers with CEOs and executives from health insurance companies, industry folks. Are there any campaigns that currently, let's just say, are violating this pledge to the point where they have staff who are former lobbyists?
Mia, why don't you pull this up? This is from the American Prospect.
Oh.
Top Biden campaign aide was a healthcare lobbyist. The vice president's former chief of staff once represented hospitals and drug companies. Now he's part of a campaign that is attacking Medicare for All. This is by David Dyan at the American Prospect. Biden's been really critical lately of Medicare for All.
Yes.
He's told some, let's call them, some misinformation.
Yeah.
Sounding a lot like Donald Trump the last few days.
Yes.
Said if you're going to move to Medicare for All, Medicare is gone, which I'm still trying to comprehend how you can expand Medicare to cover everyone and Medicare is gone. But we'll let him deal with that one.
Yeah.
He said a few other things, but you have to wonder, okay, fine, he doesn't support Medicare for All, but will he take this pledge that we are committed to getting health insurance industry money and pharmaceutical executive money out of our politics and commit to universal health care? Fine. If you want to fight for public option, I disagree with that. I don't think that's the right approach.
Yeah.
But are you doing it because you believe in guaranteeing health care to every single person in this country?
Yeah.
Is it influenced by the industry groups? That's the question. And he needs to be asked that question.
Yeah, this is, especially the speech yesterday, I think there's a lot of points where, Bernie was addressing some of the common misconceptions that we see around Medicare for All and around healthcare laws and everything like that. And it does get to a point where it feels comical at times when someone says, Medicare for All gets rid of Medicare. That just doesn't make sense on its face. I don't know. We should pull up that video. Where they have Splinter has that really good clip.
Oh, this is the best.
I don't know if you have. Do you have that?
Yeah,
actually?
I have it.
I actually really love. So I love this because I'm a Seinfeld fan, of course. But it does get to just how ludicrous some of these attacks on Medicare for All are. And Medicare for All is a focus of our campaign for a lot of reasons. It's what we see motivating people on the ground. It's why a lot of folks have come to our campaign in the first place because they believe in it. But it is also something that we're going to continue to focus on because there's a ton of education that has to be done.
Yes.
So this is a little funny, but it's actually educational.
It's brilliant.
Yeah.
All right.
Now, my Republican friends and some others seem to think that the American people hate paying taxes, but they just love paying insurance premiums. Oh my God, dear, the insurance premium is here. What a wonderful day. Oh, wow. Let's celebrate. Hey, another $2,000 a month for insurance, and small businesses, they just love it every month, paying those insurance premiums. The truth of the matter is that study after study has shown that as a nation we will save substantial sums of money, and the average middle-class family will save an estimated $3,000 each and every year on their health care bills.
So good.
All right. Well, there's no George in that episode, but it's pretty good. That was not Larry David. That was Bernie Sanders. So yeah, I mean, Medicare for All, as Bernie kind of showed there's a lot to kind of work through and find out. But I think one of the underrated aspects of this is how it pertains to immigrants.
Yeah.
And immigrant families.
Yeah.
Do you kind of want to go off on that?
Yeah, and I mean, even before I even start on that, like the reason why we've gone as far as we've gotten, right? And people have jumped on our campaign and supporting Bernie.
Yeah. And immigrant families.
So consistently been fighting for Medicare for All because he sees people's lives are at stake. Yeah. And he doesn't discriminate when it comes to that, right? Medicare for All means for all, A-L-L, for all, right? Which includes undocumented immigrants because they still are human beings who need to see a doctor. They still deserve the human right of being able to take care of their health and live their life safe without fear. And that's one of the things that has always stood out to me, at least in Bernie's plan. And, to the opposition, right? To the GOP that's saying, why are you giving undocumented immigrants Medicare for All? Right? Like, what makes you think that they deserve it? They're just coming here to take our benefits and blah, blah, blah.
Sure.
Well, in reality, undocumented immigrants pay taxes. They're the ones that are holding our social security system in place. They pay, according to Define American, $23.6 billion in federal income tax in 2015 alone. And that doesn't even count the local $11.64 billion in state and local taxes and the $13 billion that goes to Social Security.
It's almost like when Bernie talks about Medicare for All making healthcare a human right, he's talking about human beings having the right to healthcare no matter who you are.
Who would have thought?
Yeah.
Who would have thought?
Humans.
Right?
I'm sorry, not humans. Humans.
I just want to say, if people that don't have healthcare, if you're struggling to pay your bills, we want to hear your stories. Put them in the chat. Those stories don't get told very often. No. And I think what this campaign does is tell those stories and talk to people. So I want to hear if you have an experience with the healthcare system. Maybe you love our current healthcare system. Maybe you love paying premiums and you love your health insurance company. I would love to hear that as well. Please put that in there. If you love your insurance company, let's talk about it.
Yeah.
Hashtag no one.
Yeah. I love Blue Cross Blue Shield.
Did you guys see the clip of Joe Biden at AARP where he asks, he says, how many of you love your private health insurance company? And there's 8 hands in a room of probably 300 people that go up.
I just adore Aetna. I love how Aetna calls me up and just says,
But one thing I did want to mention is I see a lot of people are commenting saying that they've donated $27 or $15, and that's amazing. Thank you so much. Like, you guys are the ones that keep us going. Yes. You're the ones that make up this entire campaign. You're the one that reminds us kind of what we're fighting for here. So thank you.
This is a great comment. Affinity says, American citizen here, moved to Canada March 2018. Wife is Canadian. We would literally go bankrupt in the States with her medical needs, epilepsy, a few other things, whereas it's entirely free here.
That reminds me a lot of what Rob Delaney always posts, right? Rob Delaney, epic poster, and an actor. Actually, you wouldn't believe it.
Fantastic show.
Yeah. You're like, he often talks about, they moved from America to London, where they have a universal healthcare system, and he lost his son, his infant son, which is devastating. But he talked about how they were going through so much pain, they were working through such a traumatic time, but they didn't have to worry if they had health insurance. Yeah. And listen, there's nothing easy about what they went through, but the fact that was eliminated from what they had to deal with and what they had to worry about made their quality of life all that much tolerable in such a intolerable time. Yeah. So, it's just this real impact. It's not just some big picture policy that they talk about on the Hill. But
this is another great comment. Eugene Debsite, awesome name, amazing. 28 years old and never been able to go to a dentist. Very scared of the idea of hearing I need thousands of dollars in dental. Where Medicare for All on dental and vision? That's a great question. Where is Medicare for All on dental and vision care?
You were covered.
Yeah,
Everything.
Everything.
yeah, and dental, vision, hearing. I mean that mental health.
Yes.
What Medicare for All is, what Bernie has
Reproductive
introduced,
rights.
reproductive rights. Putting forth something that gives you greater care, more complete care, and you know that actually. I want to get into how the media has been covering.
Yeah,
some
that's
of
good.
this.
Let's do it.
This is something. So, Joe Biden's out there, and Republicans are out there as well, making a lot of claims about Medicare for All. I think we're the type of campaign that really embraces a debate of ideas, right? If you come at us with your vision and we present our vision, that's a discussion that we're ready to have and we want to have it. But if you just straight up lie about Medicare for All, if you parrot Republican and even Donald Trump talking points about Medicare for All, fuck that. I should have picked different words, but
No.
So this happens on a national level and even a local level.
Yeah.
Can you pull that up
can
real
you
quick?
pull it up right here?
So this is the Des Moines Register, which is an incredible newspaper, and people need to support local news. Subscribe to the Des Moines Register. If you want coverage of what's happening in the Iowa caucus right now, no other outlet is covering it like the Des Moines Register. We love them. They're great. You know, everyone that we've worked with there, Bernie loves them as well. However, you know, this is what you'll find sometimes when you're looking through coverage of what Joe Biden talks about. A headline: Joe Biden on Medicare for All, adding another 300 million people in one fell swoop. Medicare goes away as you know it.
Let's take it apart.
Yeah, pull it off this trash off the screen.
What?
Yeah, so
What?
Medicare goes away as you know it is a lie that Donald Trump started about Medicare for All. You know it's a Donald Trump lie because it doesn't make any sense.
Yeah.
Medicare for All expands and strengthens Medicare. So Medicare for All going away as you know it, that just doesn't make sense to me. You had a take on this earlier today that had me laughing a little bit.
Oh man, what did I say?
You basically said like, well, in a sense, Joe Biden's finally telling the truth about something. Medicare, as you know, is going to get better.
It's true. Medicare is going to improve. I mean, we just talked about this. That Medicare doesn't cover dental, it doesn't cover vision, it doesn't cover hearing right now. And under Medicare for All, we're going to cover all three, and we're going to cover much, much more. So he's right. Medicare, as you know, it goes away, but it's going to be a lot better than it is right now.
Want it, right?
Yes.
Yeah.
If you could have a better option.
Yeah.
And that's the difference. We're not trying to keep the status quo. We are trying to make some progress in this country. There's another part of this that's a lie too, and maybe he just doesn't understand how we're doing it. So I'll give him the benefit of the doubt. But he says adding another 300 million people in one fell swoop. Well, that's wrong. Bernie's plan actually has a transition. There's 4 years. We're going to take the most popular program in America, Medicare, and we're going to move it, and now it's going to cover everyone 55 and up. And then we're going to take that down and we're going to cover everyone 45 and up, and then 35 and up. And by the end of 4 years, every single person in this country is going to be covered under a plan that already works really, really well. We're not creating something new here. We are doing something that works really well, and we're expanding it to every person in this country. And let's remember, this is already done in every single major country in the world.
Yeah.
This is not revolutionary stuff. It's not radical stuff. It's only radical in the United States of America, where we've allowed private health insurance companies to control our system to make as much money as possible at people's expense.
Yeah, so I mean, what we're seeing here is that what Medicare for All is, to me, seems pretty straightforward. It's kind of in the name. It's going to be Medicare still, and it's going to be for all.
It's like
that
a
means
really confusing point, though, to people really cannot understand that.
It reminds me of that Simpsons episode about the monorail where he goes, mono equals one, rail equals rail. All equals all. Everyone gets Medicare.
ALL.
Yeah, that's a little Simpsons reference for everyone out there. But the other clip I want to bring up that shows how Biden's misinformation about Medicare for All is often covered. It was in CNN, a report from the field, actually at a similar event. I think actually the same event. He was really on a roll that night. Where he talked about the rural hospitals. Now, Iowa, this is a huge issue across the country. Rural hospitals are closing. Yeah. I'm actually going to scroll down here.
Let's pull this up.
Yeah, so Medicare for All, so he talked about basically this rural plan, and he wanted to talk about how it affected healthcare and everything like that. Now, his plan, is leading to some pretty good stuff. I need to find it, is the problem.
The actual quote? Or?
Yeah, basically. Here we go. He's talking about Medicare for All here, saying it threatens rural hospitals because Medicare reimbursement rates are just too low for these hospitals to keep the doors open. This is a really dangerous lie. Especially in a state like Iowa where this issue matters a lot. This is something that needs to be checked immediately and just be known as completely false on its face by the media when they're covering Joe talking about Medicare for All. The idea that Medicare for All would hurt rural health care does not make sense when rural communities are facing incredible uninsured and underinsured rates of patients coming in. I mean, like you were talking about earlier, so much of Iowa's population in rural communities is an immigrant population.
The intersectionality of it, right? It's being low income. It's being geographically in like the wrong place, right? Like we have hospitals closing down. We have people who have to drive miles and miles and miles to a different city to be able to get health care. And that's not the way that it should be. No matter where you are, how much money you make, you should not have to do those types of things to be able to be covered, right?
In rural America, in Iowa, to say that this would close down hospitals, I mean, what he's trying to say here is that, there's these reimbursements rates and he's trying to get wonky. What Medicare for All does is it insures everybody so that when they go into a rural hospital, and by the way, rural areas are disproportionately more underinsured than anywhere else in America, it's going to make sure that you have insurance so that someone can pay for your care, because right now rural hospitals are footing the bill for a lot of the treatment, and that's what's leading to this crisis throughout the country. There's a lot of other factors put in place, one of them skyrocketing healthcare costs. Medicare for All creates a single payer system where the government negotiates the price, and that allows for prices to dramatically decrease in rural areas as well. So, and then you add on to it that Bernie, started or helped fund the community health centers, which is a big part of rural health care. It's just so wrong on so many points that,
and it doesn't make sense either. Like, especially with the Biden story, right? It's, we're going to make sure you keep your Medicare. It's already not working. Why would we want to keep it? Like, it doesn't make sense, right? It's not like anything logical that would help people.
This is a really good comment by Eric Moss. If we could, Samaria, just scroll up slightly a little bit there. More about the startup that got crushed by medical bankruptcy. The engineer's wife made just enough to not qualify for Medicaid, so they had to get divorced to get help. There shouldn't be a line between who's deserving of health care and who isn't. Based on how much money you're making. There's
a lot of candidates are saying healthcare. I believe healthcare is a right. In fact, Joe Biden has said that. A lot of other candidates have said that. If you want healthcare to be a right, you need to make it possible not just for people to qualify for health insurance or find it on an exchange or whatever. Healthcare as a right means people have the insurance already. People have the ability to get the health care, not just qualify for the insurance or anything like that. And that's what we're talking about right here. Making just enough so you don't get Medicaid. All these games that they play by means testing people. We need a universal program that gives health care to everyone. Well, other than that, besides the minimum wage and Medicare for All and checking the media when they talk about Medicare for All, is there anything else that you guys have, or are we good here?
I just want to say, everyone watching this, whether you agree with us or don't, you play an important role in moving this country forward and continuing this conversation. This shouldn't stop here. You can follow Bernie on Twitter at Bernie Sanders. At Bernie Sanders. You can go to Facebook, facebook.com/Bernie Sanders. Instagram as well. We are talking every day about these issues, not just Tuesday and Thursday at 6 p.m. Eastern time when we're live. And you can also go and talk to your friends about this. You can be a part of this campaign. You can volunteer for the campaign. You can donate if you have a little bit extra money at live.berniesanders.com. This campaign this movement is about everybody who's watching this stream right now, talking to their friends, being a part of it, continuing the conversation outside of this hour, and making sure that we're organizing to create the type of change that we're talking about. That's the way I want to end it. Do you guys have anything else to add?
No. I mean, if you have any questions, send them our way.
Yeah, we'll continue to answer them. We will be back on Tuesday at 6 p.m. Eastern Time.
Yep.
We've got a busy week. We're about a week and a half away from the first debate. We're going to find out tonight, actually, what night Bernie's debating on. And, hit us up. We're on Twitter as well.
Yeah.
We will see you next Tuesday.
Yeah,
you want
get
people in your mentions?
Yeah, why not?
Bill wants more followers.
Yes.
Oh, jeez.
Thanks a lot for joining us.
Good night.
We'll see you next week.